The government has undertaken a thorough review of the hospital authority. It's the first study of the HA's effectiveness since the authority was established in 1990. The main purpose of the review is to examine HA operations in response to changing conditions, including the challenge of an aging population. Anthony Wu, outgoing chairman of the hospital authority, explains why he welcomes the review.
I think for any organization, review every now and again is absolutely necessary. In fact, in the last few years, we have carried out a few reviews on our own. This is the first time since HA's formation that a review is carried out by government on a sort of a bigger scale, engaging a panel of independent members to look at it, which I welcome. I think for any organization, you can always improve, and for some independent people to render their independent opinion from their own perspective.
The review committee has held its inaugural meeting. Although it is yet to prioritize areas for review, Wu says he's most concerned about manpower problems and the long waits patients must endure before they are treated.
To me, I think the most fundamental problem that we need to address is manpower in the public system. I do think that with the aging population and the increase in chronic diseases, that the demand on medical services is on the rise. And for example, just take the elderly. An elderly would visit us 4 times more than somebody below 65, let alone the complexity. And we recognize, and we did some calculation, an elderly would consume 9 times more resources than a non-elderly. Therefore, we do need more doctors and nurses and allied health and other medical professionals to look after this increase in demand.
While facing the manpower challenge and long waiting times, the HA, Wu points out, has done a lot to solve problems, though there's still a long way to go.
We have done many things, but again, manpower is. If you give me 2,000 doctors tomorrow, then I may be able to cut the waiting time very fast. And we have done a lot of pilot, like the cataract scheme that we have worked with the private sector, so that we subsidize a certain amount for the patient to go out to the private sector, like some of the CT scan or MRI that we work with the private practitioners, and also on a lot of the GOPC, the general patients. Again, we subsidize a patient to go out to practitioners, and also we have employed part-time doctors. We have given a special honorarium to our doctors who work long hours or during when they feel fit to do another session or something. We also allow patients to go cross-clustered. So we have done many things, and also, of course, we look at our procedures, how we can sort of streamline and be more efficient with our procedures, so that to cut the waiting times, because we are concerned about the waiting time. Now the medical students has increased to 420. The first batch will come out in 2015, and the Medical Council has also approved to increase the number of licensure examinations from once a year to twice. And then we will continue to apply for our limited registration. And so, we are doing many things to increase our manpower in the public system, so as to cut the waiting time. In year 2000, the government gave us already 30-something million. I think, look at the absolute figure, you may think it's big, but don't forget we have to train the doctors, and we have to stand by for crisis. For example, last year at National Day, the ferry crisis, all of a sudden when you have, if you remember the Bellarmine crisis, bird flu, swine flu, and now we're talking of infectious control and everything. So, we do need a lot of resources to stand by for urgent situations and crisis. So you can't just look at us and compare with a sort of private service provider, because we do have a lot more duties that we have to discharge.
As Wu prepares to step down December 1st after 9 years at the helm, he says he's deeply impressed by the passion and selfless contribution of healthcare workers in Hong Kong. Many foreign health ministers, he says, have been impressed with what Hong Kong's public healthcare system has been able to do.
There are many unforgettable events, but one thing that impressed me most is really the passion and the selfless contributions by our frontline medical professionals. I go to hospitals quite often, and sometimes late at night. As a Hong Kong citizen, I am most grateful to them. They work so hard, and I'm really grateful. And Bloomberg has just issued a report comparing the medical services in different countries, and Hong Kong ranked number 1, meaning that we provide the best services. Also, we are the most efficient. We only consume 2.6% of GDP, much lower than any other places. And I have received many health ministers from different countries, US, UK, Australia, Canada, and when they look at what we have been able to provide with the resources that we're given, they were all very impressed. And again, without the hard work and the dedication of our frontline staff,